Hello and welcome to the 1% Solution. Here you'll find tips and tools to help you acquire more doctor clients one small step at a time. I'm Dr. Vicki Rackner, your host. I want to thank everyone who offered ideas about what you'd like to learn about in the video series. Probably the number one question was, how do you get doctor clients in for the scheduled meetings? And that's what I'd like to address today. Many of these ideas come from my dentist, Dr. Doty, and his hygienist, Colette. They deal with a very difficult question. How do you get people into a dental chair on a regular basis? So even though you don't pull teeth, sometimes it might feel like you do. So here are 3 tips. Tip number 1, deliver a great experience during the client meeting. Now, you've got a reason that you conduct them. What do you want out of this meeting? However, the much more important question is, what does your client want to get out of the meeting? In general, clients come into meetings with you for the same reason that you go to the doctor. Maybe you want a diagnosis. You might want a treatment plan. You might just want to know that you're not all alone. You might go to a doctor because you want hope. So one of the first questions you want to ask is, what would you like to accomplish today? And then listen carefully. Always keep in mind what your client's hopes and dreams are. They've come to you because they want a transformation. They want to go from where they are now to where they'd like to be. So paint a picture of that dream. Show them where they are now and show them how far they've come. It's like the progress bar when you're doing something online. Give a physical gift, something that clients can take home. Maybe it's something as simple as branded notepads or a meaningful book. Offer an atta-girl or atta-boy. Find something that they're doing right and reinforce them. Always paint a picture of a very hopeful future. Second, manage the meeting logistics. When I was a practicing surgeon and somebody tried to get something on my calendar, I'd often say, sorry, I don't manage my own calendar. Either speak to my assistant or to my husband. So when you're meeting with your clients, ask them, who manages your calendar? With whom should I set up this schedule? Second, include the right people in the meeting. Of course, you want to speak with the husband or wife or life partners, but maybe for some meetings you want to include the kids or parents also. Schedule the meeting for the right time of the day. You want to meet with doctors when they're fresh. Consider where you want to meet. It's easier for you if doctors come to your office. However, it's easier for doctors if you go to them. And the big issue, remember, is how do you get doctors to meetings? Let me also point out that there are distinct advantages in meeting doctors in their homes. You'll gather intelligence that you would never know if you met with them at the office. Does it make sense to include video conferencing as an option for your physician clients? Last, ask yourself and your doctor clients with what frequency you want to be meeting. End the meeting by taking out your calendars and finding a tentative date for the next one. If you've got a doctor who's evading your invitation to a meeting, be a pest nicely with a little humor. You can go online and order prescription pads for yourself. Then you can send a doctor a prescription, schedule a 45-minute financial wellness checkup. It won't hurt, promise. My dentist always joked with me, you don't have to brush and floss all of your teeth, just the ones you want to keep. Next week, we'll talk about tips that you can use to schedule meetings with prospects. And the week after that, I'll offer some tips about how to give advice that doctors actually follow. Thanks again for investing your time. I hope that you found value in this content. Please feel welcome to pass this video along to friends, colleagues, broker-dealers. If you've gotten this video, you're welcome to go to Targeting Doctors and get on our mailing list. See you next week.